This is how to make a double transducer. Today we're going to utilize an Edwards Life Science pressure monitor, a double transducer. As always, we always wash our hands first to make sure that we're not going to contaminate anything. We open the tray and without getting rid of the cover so that we can use it as a staging area. First thing we do is we take the spike out and put it away so that we have more space on the tray. We start working from the transducers. We have two of them. One, this is the arterial because it has the vamp system, and this is the CVP, which it doesn't have the vamp system. And we start tightening exactly like the single transducer. We start to tighten the joints against each other. We start at the proximal side of the transducer and same thing. As we get to the vamp, we gotta make sure that we close it and hear the clamp or the click. That's when it locks into place so it doesn't come back out. We continue, tighten against each other, and we're good. Now what we're going to do is we're going to either put the caps on or label. We're going to label first. Same as with the transducer, the single transducer. We're going to label red on the tubing right after the transducer to make it easier to identify when you're going to connect it to the pressure cable. We follow through and put a nice little red dot in here. Because this is not used that much, we don't need to label it too much. Then the written arterial label is going to go on the tubing before the stopcock. This is done in order to avoid anybody on the floors or in the OR, but mostly on the floors, from giving medication into an arterial, into an artery. Then we label the CVP in the same manner on the tubing right after the transducer. We put the two dots so that the doctors can see from anywhere where is what the color is, and they can identify what they're going to do. Put a nice blue dot in here. This is going to be used essentially twice. Once when it is connected into the OR, and once when it connected in the ICU or the recovery. Then we label with the CVP PAP facing towards the stopcock, the lower lock, so that it's nicely and properly labeled. And it is labeled before the stopcock so that if they change this, the line is going to still be labeled. The reason why this is labeled on the tubing is because every once in a while you will have a transducer failure. So if you need to change the transducer, you can take the transducer, but you still have the signaling as to what the labeling as to what that transducer is, and you don't have to relabel everything. Sometimes the anesthesiologist in holding will take a 6-inch extension, put the A line in holding, and then come in and throw away this stopcock, but they leave the tubing. So if you label this, you essentially don't know where you're putting the patient at risk of somebody by mistake giving medications on the A line. We're going to change the caps. Some people do this to get a little bit more access. nice and sterilely. Put the caps on. And we have to return it back to closing on the stopcock. Or you can just do it like so, without touching anything. As you can see, the lure lock hasn't been touched. Neither is this. You cut. And that is how a transducer looks.